Bonjour à toutes et à tous. Thank you for joining us today. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina. I will be your moderator. Je m'appelle Kina et je serai l'animatrice de cette séance. As usual, before we begin, a reminder to place your mic on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. So today we will be hearing remarks from Deputy Mayor, la mairesse suppléante Laura Dugas, followed by Councillor Keith Egli, Chair, Ottawa Board of Health, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, and Dan Chenier, General Manager, Recreation, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations. Available for questions from the media following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Anthony DiMonte, General Manager, Emergency and Protective Services, Directeur général des services de protection et d'urgence. After we hear from the panelists, we'll take questions from the media. We will now begin with remarks by Deputy Mayor Laura Dugas.
Good afternoon, everyone. Bon après-midi tout le monde. My thanks to everyone for joining us for today's media availability. To begin, I wanted to express my deepest condolences to the families and friends of the two individuals who drowned in the Ottawa River this past weekend. Tout d'abord, je souhaite exprimer mes plus sincères condoléances aux familles et aux amis des deux personnes qui se sont noyées dans la rivière des Outaouais la fin de semaine dernière. These are incredibly tragic events, and I want to take this opportunity to remind people to practice safe water safety while they're at our beaches. As of 12:01 a.m. on Tuesday, Ottawa Public Health made face masks mandatory in enclosed public spaces in Ottawa. Santé publique Ottawa a rendu le port de masques obligatoire dans l'espace public fermé d'Ottawa. Ottawa Public Health is joined in this action by the Eastern Ontario Health Unit, Leeds, Grenville, and Lanark District Health Unit, and Renfrew County and District Health to make this a truly regional approach. As our medical officer of health, Dr. Etches, has noted, scientific evidence indicates that wearing a mask can help reduce the transmission of COVID-19. Wearing a mask helps to trap the virus, thereby protecting those around you. And this is important because some people can be infected by COVID-19 and not know it because they're not displaying any symptoms. And when other people wear a mask, they're helping to protect you as well. On Wednesday, we will put forth a motion at our City Council meeting to institute a bylaw which will ensure that residents of the City of Ottawa wear a mask in enclosed public spaces. In the meantime, the directive invoked by Dr. Etches will remain in effect. It is also important to remember that wearing a mask doesn't mean that we can let our guard down. We must continue to practice physical distancing, even when we're wearing a mask. Il est également important de se rappeler que le port d'un masque ne signifie pas que nous pouvons relâcher notre vigilance. Nous devons continuer à pratiquer la distanciation physique même en portant un masque. It also doesn't replace other protective measures like hand washing, as well as avoiding touching your face, nose, or mouth, and isolating yourself when you're feeling sick. I would like to take this opportunity to thank our local businesses for their continued support for this directive. And I also want to thank our residents for their compliance. Je tiens également à remercier les résidents pour le respect des règlements. We also realize that some people haven't been able to access cloth masks as of yet. For residents who are still looking to purchase a cloth mask, you can access our mask vendor list at ottawapublichealth.ca. United Way East Ontario has also partnered with Ottawa Public Health to launch the Facing Forward project to help supply cloth masks to residents who are in need, such as isolated seniors and the homeless community. You can buy these cloth masks in bundles of 25 for your workplace, for family, or other groups. and proceeds from your purchase will provide masks to those who are most in need in our community. United Way volunteers will be at 10 OC Transpo stations starting this coming Monday until next Friday between 6 a.m. and 9 a.m. selling these facing forward masks. And you can also visit the United Way East Ontario website for more information on how to purchase a mask. In addition, residents who do not have the means to purchase or access cloth masks can contact the city's Human Needs Task Force at 613-580-2424, extension 26753, or by email at hntf@ottawa.ca. With that being said, there's also an urgent need for masks, and the Human Needs Task Force is looking for donations of cloth masks to distribute to vulnerable residents. These masks will be distributed throughout the city to community partners who will connect with people who have no other means of accessing a mask. To make a cloth mask donation, you can email donations@ottawa.ca to set up an appointment for drop-off. The introduction of the directive to wear masks in indoor public spaces comes as the city's first phase of its reopening plan has swung into full gear. Client service centers at City Hall and Ben Franklin Place, along with the Planning Services Counter, are now providing some in-person counter services by appointment only. The 4 employment and social service centers have also reopened for limited counter and document drop-off services. And more than 500 reservations have been confirmed since appointments were made available on Friday, July 3rd at 11 a.m. And our staff are doing a wonderful job. Notre personnel fait un excellent travail. Since our reopening on Monday, 90% of clients were seen 3 minutes before their scheduled appointment. Our facilities have COVID safety measures and protocols in place for your safety, as well as for the safety of other residents and for our staff. When you have appointments in our client service centers, we ask that you arrive alone and that you wear a mask. We're also very pleased that our modified summer camps kicked off this week, and more than 85% of the available spaces have been filled for the summer. This, in addition to the opening of city daycares, has provided much needed support for those who needed to return to work. Childcare is an important factor in helping our economy recover. And just in time for this week's heat, the first wave of wading pools has reopened, joining our splash pads for summer fun and relief, with indoor and outdoor pools gradually reopening for public and lane swimming. And you'll hear more details about the pool reopening shortly from Dan Chenier, our General Manager of Recreation, Cultural, and Facility Services. Before I close, I wanted to mention some of the measures we've taken to help promote the Byward Market during this incredibly challenging period. The Byward Market is a popular destination, so we have made plenty of room for physical distancing. Le marché Bay est une destination populaire. Nous y avons donc aménagé beaucoup d'espace pour respecter les distanciations physiques. The closures of sections of Byward Market Square, Clarence, and William Streets have created more space for pedestrians to safely get around, and for patios to expand into the roadway to accommodate even more customers. As of today, we've also closed the northern side of York Street from Byward Market Square to Sussex. And these closures will be in place now throughout the end of September. Ces fermetures seront en place jusqu'à la fin du mois septembre. We've removed some on-street parking in order to make these changes, but there's still plenty of parking available in city parking lots at 70 and 141 Clarence Street. And we've installed new bike racks in Byward Market Square. We hope everyone enjoys strolling the new pedestrian promenades to visit local shops, services, and patios in the market. Please remember to practice physical distancing and wear your masks when entering a place of business. We've come so far over the last many months, and while we know we still have a way to go, it is our shared responsibility to continue to prevent the spread of the virus. We can do this, Ottawa, together. Thank you. Merci beaucoup.
Thank you very much, Deputy Mayor. We will now be hearing from Chair Aglai.
Good afternoon. Bonjour, Quay. I'd like to thank the residents of Ottawa for adapting so quickly to wearing masks in enclosed public spaces, especially considering the heat we've experienced this week. It's not comfortable, but it is important. I've seen firsthand how well businesses and residents have adapted and embraced our new reality. And I'm very proud of how many of our community got on board and are willing to make a small sacrifice to protect each other. We know this is a new habit, and it can be strange to walk around stores and see people in masks. Local businesses and their employees are doing important work to protect our communities in supporting the mask initiative. Thank you for continuing to be so kind to one another. It's been said before, but it's important to remember that we're all in this together. And part of that is acknowledging and respecting the fact that not everybody can wear a mask. So if you see someone without a mask, it may well be for a very real medical circumstance. So please keep that in mind when interacting with people in public places and with staff in public places as well. Wearing a mask is an extra tool in our toolkit that not only helps to prevent transmission, but can also help us as a community get one step closer to reopening the city and getting back to regular activities. The past few months have been a struggle for many in our community. These are unprecedented times, and we need to ensure that we can reach out for help when and if needed. Ottawa Public Health's recent report on the status of mental health during COVID-19 pandemic found that a staggering 2/3 of Ottawa parents with school-aged children at home are concerned about their children's mental health and emotional well-being. And it's not just children who are being impacted. We found that parents of school-aged children are reporting poorer mental health and higher daily life stress than other subpopulations of adults in Ottawa. Mental health is an integral part of living a healthy life, and we're working hard to support Ottawa residents as much as possible. Ottawa Public Health's next steps to support the mental health of community members during COVID-19 pandemic includes expanding on the work we have already begun. We are exploring other ways to reach community members that do not access information online. This includes partnering with health and resource centers and a variety of other community organizations to best meet the needs of our residents. You may be aware that at the beginning of the pandemic, we published a list of all the mental health resources available for residents on ottawapublichealth.ca. Should you or a loved one need support during these difficult times, please visit the website and seek help. Thank you again to the residents of Ottawa for your willingness to help protect each other by wearing a mask and helping our community reopen safely. Stay cool, stay safe, and please, if you are able, wear a mask. Thank you.
Thank you very much, Chair Aglai. We will now be hearing from Dr. Etches.
I also want to express my deepest condolences to the families who've lost children in the drownings this last weekend. And I want to thank Ottawa businesses and the whole community for continuing to adapt and support each other as we go through this pandemic. The numbers show that we have been successful so far at keeping this virus pinned down, but now is not the time to let up, particularly because we still see cases. And this happens especially when people are going out and not staying home when they're sick. Les données montrent que nous avons réussi jusqu'à présent à ralentir ce virus, mais ce n'est pas le moment de prendre du recul ou de baisser la garde, car ce virus est implacable et cause toujours des infections, en particulier lorsque les personnes malades ne restent pas à la maison. And as we have learned, not everyone feels sick when they're infected, and so masks are used to help stop transmission from asymptomatic and pre-symptomatic people. So this week, I noticed Ottawa Public Health's mandatory mask signage on storefronts across Ottawa. Businesses have been quick to respond to this new directive, and I'm seeing an increase in the number of residents wearing masks while in enclosed public spaces. This is really encouraging, and I thank everyone for doing their part to keep COVID-19 low in our community. Mask use is an important measure to help employees feel more protected in the workplace, and it supports customers in feeling safe enough to go out into stores and participate in our local economy. L'utilisation des masques est une mesure importante pour aider les employés à se sentir plus protégés sur le lieu de travail, et elle aide les clients à se sentir suffisamment en sécurité pour aller dans les magasins et soutenir l'économie locale. It is important to get our economy back on track, and that's important for the health of our community. People need to return to their jobs to be able to support themselves and their families. And as we start to get used to entering establishments with masks, businesses will appreciate us treating their employees with civility and respect. This is a time when many of us are getting anxious, we're getting used to change, but please do not just direct any frustrations you're feeling towards businesses and employees. To support businesses to understand their requirements, we have updated our frequently asked questions on our website. We have sample policies and signage there. And residents too can always go to ottawapublichealth.ca to learn about masks. So I'm going to turn to the subject of schools. Certainly the level of infection in our community has a lot to do with the risk to introducing COVID-19 into schools in the fall. We need to keep our caution up, our protections up, so that we have an opportunity to reopen schools. And last night I had the privilege of participating in the Ottawa Carleton District School Board consultation with parents regarding the reopening of schools. And I noted my recommendation to balance the risk of COVID-19 infection with other observed impacts on the health of children, youth, and families. Specifically, given the situation in Ottawa now, and if the trends continue, I recommend starting with 5 days of school in person and working to make this as safe as possible through reasonable and feasible infection prevention and control measures, including rapid responses to stop transmission when infections occur. Compte tenu de la situation actuelle à Ottawa, je recommande de commencer par 5 jours des écoles en personne et de s'efforcer de rendre cela aussi sûr que possible par des mesures raisonnables et réalisables de prévention et de contrôle des infections, y compris des réactions rapides pour arrêter la transmission lorsque des infections se produisent. So existing scientific research regarding children and COVID-19 indicates that children tend to have mildly symptomatic or asymptomatic infections, and that they may play less of a role in population-wide transmission than adults, so the evidence is inconclusive. There's just not enough. Ottawa children and youth have not been physically present in a school setting since early March. And we know that this has been a major cause of stress for families. And Ottawa Public Health has been assessing many factors, including the impact of school closures on children, youth, and parents, on people working from home, on the return to the workforce of essential workers, including healthcare workers, on mental health, on domestic violence, on the risk of outbreaks, and more. So having received significant feedback from Ottawa families regarding the province's school safety plan for the 2020-2021 year, we are sharing these concerns in our conversations with partners and the province. And so taking these considerations in mind, there is mounting evidence related to the harms of children not being in school, both for individuals and at the community level. So the challenge our community is facing is to balance the risk of transmission of the virus with the risks of keeping children home from school. Our ongoing evaluation as we proceed and input from all stakeholders and learning from other jurisdictions that have proceeded with school reopening ahead of us will be important. We need to continue the dialogue and the engagement and the monitoring, but return to school is a key part of learning to live with COVID-19. And keeping the virus level low again in our community is a key part of supporting a safer return. Part of our learning about the impacts on youth was a commissioned focus group report. We used an external consultant to make sure we were hearing from youth. And we learned that youth do understand physical distancing and the importance of public health measures. However, they have voiced that this pandemic is challenging their mental health. We're seeing that they listen to friends, they listen to family, to sports figures and online personalities, and as a community, that they'll appreciate us continuing to support and encourage them to show them that their efforts are making a difference. We can lead by example and be open to the conversations about the experience of youth. So Ottawa Public Health is currently working on a communications approach, primarily using Instagram to continue to share information and engage with youth and young adults on this preferred platform. Much of our recent focus has been on COVID-19 and our efforts to flatten the curve, but I'm just going to take a moment to touch on these other infections that are worth keeping in mind at this time of year, those spread by black-legged ticks and mosquitoes. So just as people in Ottawa are taking measures to protect themselves from COVID-19 infection, residents' efforts to make tick checks and avoiding mosquito bites part of our daily routine will help prevent unwanted infections. Tout comme les habitants d'Ottawa prennent des mesures pour se protéger contre l'infection par la COVID-19, les efforts des résidents pour faire des contrôles des tiques et éviter les piqûres des moustiques, une partie de notre routine quotidienne, aidera à prévenir les infections non désirées. For more information, please check our website on Lyme disease and West Nile virus. So in closing, I want to invite everybody to take part in our newest survey. We continue to value community perspectives and we need your input to inform our response. We want to know your priorities and how we can help local businesses as we ease up on restrictions. Controlling COVID-19 is a community effort and we do need to hear your voice. So the new survey and forum questions are available on Engage Ottawa, engage.ottawa.ca/COVID-19, and this survey will close on July 23rd. So remember, wearing a mask is an added layer of protection to those around you. It's not a substitute for things like isolating yourself when you're sick. Stay home if you're sick, staying 2 meters apart from others, and exercising proper hand hygiene. Nous devons continuer à faire preuve de compassion, car tout le monde ne peut pas porter un masque. Il est important d'être COVID avisé et d'être gentil avec elle. Nous vous remercions de faire votre part pour vous aider les uns les autres. Thank you again for helping each other. You, Ottawa, are saving lives.
Thank you very much, Dr. Etches. We will now be hearing from Mr. Chenier.
Thank you, Kina. Good afternoon, everyone. Bon après-midi. A big part of the city's reopening over the last week has been around recreation services. And certainly one of the things that we've learned is that through the pandemic, how much parks and recreation services have been missed by our residents. Cette pandémie nous a rappelé à quel point notre collectivité compte sur les loisirs et les parcs. In the weeks leading up to the reopening, we've been loosening some of the restrictions on sports fields and ball diamonds and sports courts and parks. And since then, we've reopened our splash pads, which are very welcome in this heat wave. And we now have, starting last week, lifeguards on our beaches for supervised swimming. Based on the temperatures that we're experiencing, this was a timely reopening. À constater la température, ils sont ouverts en bon moment. This week, as the Deputy Mayor mentioned, we also reopened our summer camps at 43 locations across the city with a very high level of interest. And even though these are very basic camps, as we advertised some weeks ago, parents have already been telling us two things primarily: how glad they are to have their kids in a structured program playing with other kids, but also how reassured they are by the attention to detail we've placed on keeping their children safe. This week, we've also reopened 25 of our 53 wading pools across the city, and the remaining wading pools will open next Monday, July the 13th. As with many reopenings, our precautionary measures and protocols make things a little bit different than they were in prior years. And it's taking some time for our clients to get used to it, but so far it's going very well. We remind parents that the number of children in the wading pools at one time this year has been reduced to help support proper distancing. And depending on the wading pool size, the maximum is for the smaller pools around 8 kids, and for the larger pools, 15 children, which if you've seen wading pools in past summers, is a very low number to get used to. But so far, we've had very good compliance by both the parents and the kids. To accommodate this, where we have a high number of children waiting to swim, we've instituted a 30-minute swim sessions with children rotating in and out of the pool. This is only required when there are more children than the pool maximum. And in many cases, children can swim longer than that period. So far, it's going very well. In the first few days of reopening, things have been running very smoothly. And so far, this heat wave has made the wading pools and the splash pads very popular places. Reminds me to thank parents for their efforts to help ensure physical distancing and safety measures are met at our splash pads across the city. As you know, these are not supervised, but we have good anecdotal reports from our park ambassadors and from other parents who are writing to us, commenting on how well people are doing and respecting the distancing requirements, even as they're frolicking in the splash pad. So that is good news for us. This week, we also reopened 6 of our indoor pools and 6 of our outdoor deep water pools for swimming, public swimming and lane swimming. And the clients who are returning to these facilities are again experiencing new measures to maintain distancing and reduce the spread of infection. We're offering 1-hour swimming sessions that residents are invited to book into ahead of time because of the number of bathers that can be in the pool at one time, and again, a significant reduction. The 1-hour sessions have been implemented to provide as many people as possible an opportunity to swim and to cool off. Nous offrons des plages horaires de baignade d'1 heure. We will have 15-minute breaks in between each session so that we can thoroughly clean and sanitize the public areas of the pool. Information on the pools that are open and their swim schedules can be found at ottawa.ca. Currently, you can call the facility that you intend to visit directly and book a time for your swim, but we are hopeful that within the next few days, this will become an online function through a tool that we will be implementing. Again, to ensure physical distancing. Je souhaiterais itérer que pour s'assurer la distanciation physique, la capacité des piscines a été réduite de façon importante. We've also implemented preventative measures and protocols in our swimming facilities to protect you and other swimmers and staff. This includes designated entry and exit doors, directional arrows, physical distancing markers, and frequent disinfection of the common areas and high-touch areas in the pool. While the pools are open, most of the complementary amenities like saunas, hot tubs, water slides, swing ropes remain closed for now. While we don't expect you to wear a mask in the pool, you must wear one while walking into and out of the building. We will also be opening registration for our summer swimming lessons on Monday, July 13th at 9 p.m. Details of lessons are available now in our e-guide on ottawa.ca. Vous pouvez maintenant consulter le cyberguide cours de natation au ottawa.ca. In addition to the safety protocol, swim lessons have been modified for children's protection. Young children will need a parent or guardian to accompany them in the pool, allowing the instructors to maintain the 2-meter distancing as well. All pool equipment that are used in the lessons, life jackets used as part of the program, are disinfected after each use. And while learning to swim is an important drowning prevention skill, we urge everyone, from the strongest swimmers to the not so seasoned swimmer, to stay safe and vigilant around the water. This is especially true around our natural waterways. C'est particulièrement important dans nos cours d'eau naturels. Only swim at supervised sites when lifeguards are on duty, and remember to keep children within arm's reach at all times. A reminder that that Ottawa has complex waterways, especially the Ottawa River, with sudden drop-offs, currents, and undertows, which are a challenge for even the most seasoned swimmer. We've already seen too many drownings this summer. We extend our most heartfelt sympathies and condolences to the families and friends of those who experienced these tragic losses. So please go to supervised beaches and pools and practice smart water safety. Nous vous prions donc de fréquenter les plages et les piscines supervisées et de pratiquer les règles de sécurité dans l'eau. We also remind visitors to our beaches to not only be water smart, but also COVID-19 smart. Il faut donc maintenant être vigilant à raison de l'eau et du COVID-19. Always ensure that you and your household are 2 meters from others. Don't gather in groups of more than 10 or more, and wash your hands regularly. If you see that it's crowded and your space is getting compromised, move away and avoid areas that are crowded. You can pack a mask with you should you feel that crowding is making distancing more difficult. We want to make sure your summer moments with your family and friends remain memorable for all the right reasons. So enjoy the weekend with both water safety and COVID safety in mind. Thank you. Merci.
Thank you very much, Mr. Chenier. We will now invite questions from each agency. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme. Vous pouvez poser une question et une question de suivi. A reminder to remain on mute until I invite you to ask your question. We will begin with 1310 News. Deborah, are you ready for your questions? Deborah, I don't think we can hear you. So, I think we can hear you now. Can you go ahead? Okay, Deborah, we will move on to the next, but please send me a message with your questions. Moving on, we will go to CBC Ottawa, Kate Porter.
Hi there. My question, I believe, is more so for Mr. DeMonte. He's on the line, right?
Yes, he is.
Yeah. I see in the staff report that you're looking for fines of $200 to $400. I wondered if you could comment about the fine set for mandatory masks, but also there's a note there that there's not a lot of officers, just sort of how that works, like whether you actually see bylaw officers strolling in and out of stores, looking for people who aren't wearing masks.
Yeah, thank you, Kate. Actually, that's a good question. Our objective here is, should council approve the report, is to supplement what Dr. Etzes has been telling us. This is an individual responsibility, and we all have to, as a community, step up. Yes, we're putting a bylaw in as giving us new tools, but our focus is definitely education and communications with people to try to attempt them to ensure that they wear a mask. The approach that we'll be taking is that, no, we won't be patrolling for mask, mask people that aren't wearing masks to be able to give fines. That's not the approach. It is a tool within our toolkit that we have because we feel it's necessary. That's why we're putting a bylaw in place. And so that tool can be used, as indicated in the report, for people that after education, after trying to discuss with them, or that continually refuse to wear a mask in those public places, a bylaw officer can use that as a resort. So no, you won't be seeing bylaw police going around looking for masks. That's not our objective in any way. It's just a supplementary tool, and it shows our seriousness and council's seriousness if they approve this report of why we need to do this. So with regards to the $200 fine, we're just trying to get the fines in line with what you would see with a normal municipal bylaw. So we have to apply for that to the Solicitor General, and we will. And it is gives us a better tool than we could use the provincial order, but the provincial order doesn't give us any maneuvering room, and it's an $800 fine, which again, gets away from the objective of trying to get people to understand our individual responsibility.
If I can jump in as well, when the mayor and I talked about this initiative, and especially when we talked about it with Dr. Etches, we want to go with a collaborative, a cooperative, and an education approach. The bylaw, as Mr. Devonte says, will have a fine component to it, but frankly, I hope we never have to use that. And what we've seen in the last couple of days with our businesses and with the customers has been very heartening, and I think shows that we're on the right track here. So again, the intent is not to penalize, it's to educate and to work together with our business community and the residents and customers in the city.
Thanks. One other thing, I just want to fully understand this, is that does the bylaw supplant Dr. Etches's directive from this week, and it does so because you want at least the tools in the toolbox for enforcement, or does the directive live on and this matches it but adds the bylaw enforcement piece?
So I think Dr. Etch is off mute. I'll let her start, and then I can answer a little bit too.
Sure. So it's more the latter, that my instructions continue under the provincial order, which has just been extended until July 22nd, I believe. So that remains, and then should council pass the bylaw, it's an additional piece of legislation that upholds the instructions that I made, and it adds to a little more individual responsibility and more options for enforcement.
Yeah, and I think Dr. Etches has identified, if you look at the bylaw also, it clearly indicates our foundational objective here. So first and foremost, it's an individual opportunity to wear a mask and be responsible in the community. And then secondly, it also fulfills responsibilities to operators of those public places. And if you notice, we were very specific because we didn't want to see incidents that are happening elsewhere in the world where there's confrontation. So those operators will have signage that indicate please wear a mask as you enter our facility. We'll have hand washing or sanitary washing as people enter. As well, they have an obligation to verbally indicate to somebody who may have forgotten, please put your mask on, but no confrontation. That'd be a tool that we would have to use. So we have both tools in our toolkit. Dr. Etch's order under the provincial order, bylaw officers can enforce that. And now if council does approve this bylaw next week, we'll have a supplementary and a different type of tool as well too.
So helpful. Thank you.
Thank you, Kate. We'll give Deborah's audio one last try, and then I can ask the question on her behalf. Okay, so we will ask the question on behalf of 1310 News. She is asking about the overcrowded patios in the Byward Market. She says that people are without masks and sitting closer than 6 feet. So she's looking for comment on that.
So first and foremost, when we get that type of situation, we will intervene. And again, as we've been reiterating, we'll be talking to the owner and operator of that patio. They have responsibilities to put measures in place to ensure that social distancing exists on those patios, etc. And we will use an approach of discussion with the operator to try to get those situations under control. That can be challenging. I'm quite honest about that. I mean, you know, a patio full of people celebrating and enjoying themselves. But we do have a great team, and those situations, we want to get them under control because they are putting the community at risk. And so it's something that we won't tolerate, but we'll be intervening to get people to understand.
Thank you very much. Moving on, we will go to Julien Paquette à Le Droit. À vous, Julien.
Oui, bonjour. Bon, je comprends que la très grande majorité des gens ont bien saisi le message du masque obligatoire, mais j'étais curieux de savoir s'il y a quand même eu des incidents ou des des gens se montrent obstinés à ne pas respecter cette mesure-là. On sait qu'il y a une partie de la population qui ont des opinions fortes là-dessus. Donc, est-ce qu'il y a eu des incidents? Je ne sais pas si la question serait plus pour M. Dimonte ou Dr. Etches.
Comme on a indiqué tantôt, le Dr. Etches a mis en place une directive médicale sous l'ordonnance de la loi au niveau provincial. Son objectif dans la première semaine était de l'éducation et de la discussion. Et donc, on ne visait pas nécessairement d'intervenir, sauf s'il y avait un cas particulier. Je réserve toujours ça, bien que c'était l'objectif. Au niveau d'intervention du service de règlement municipaux, c'était indépendant, mais on n'a pas dû donner aucun avis, quel que soit, à date. Est-ce qu'il y a eu des incidents? On a eu des discussions avec quelques individus, mais très peu. Généralement, comme le Dr. Etches a indiqué, comme le conseiller Eglaï a indiqué, notre observance actuellement au niveau du territoire, au niveau de toute la communauté, on a au contraire un effet positif et les gens semblent s'adapter rapidement du jour au lendemain. On rentre dans des endroits où on voit un changement drastique. Fait que la réponse simple, c'est non, on n'a pas eu à intervenir à date.
OK. Donc, puis la prochaine question, ce serait pour le Dr. Etches. La dernière rencontre du conseil municipal, vous avez présenté un scénario pour une potentielle deuxième vague d'infection qui nous amènerait, si ma mémoire est bonne, au début de l'automne ou à la fin de l'été, autour de septembre. Est-ce que les chiffres qu'on obtient quotidiennement depuis cette présentation-là changent un peu la donne ou est-ce qu'on se rapproche d'une deuxième vague ou non, finalement?
Maintenant, les chiffres indiquent que la situation avec COVID-19 dans notre ville est stable. C'est bon. Le nombre de cas continue d'être faible et le même avec les hospitalisations, aussi les éclosions. Mais c'est pas que le virus disparaît. C'est vraiment qu'il y a toujours le risque d'une augmentation dans les cas. Ça peut augmenter quand on fait on a oublié de faire des distanciations physiques. C'est pourquoi on veut ajouter de l'utilisation des masques maintenant parce que c'est proche, le stage 3 et beaucoup d'autres activités. On veut être la possibilité d'utiliser tout notre outil avant le début de l'école. C'est toujours là, le risque d'avoir une deuxième vague. Et c'est le peuple d'Ottawa qui a fait cet succès maintenant et qui continue d'avoir cet impact d'éviter l'augmentation. Je pense, je travaille avec mon équipe maintenant pour différents scénarios pour l'automne. C'est possible qu'on peut continuer comme ça si les mesures de distanciation physique sont en place. C'est aussi possible d'avoir un plus grand nombre de cas. On a juste besoin de regarder notre voisin aux États-Unis pour voir les différentes lignes, les différentes possibilités d'avoir une picture concernant le virus si on relaxe trop.
Parfait, merci beaucoup.
Merci beaucoup, Julien. Thank you, Dr. Etches. We will now move on to Bruce at Ottawa Citizen.
Hi there, can you hear me? Hello?
Yes, we can hear you.
Okay. My questions are for Dr. Etches. The first one is, how do you plan on balancing the needs of kids and having schools fully reopen while also keeping vulnerable populations safe from transmission?
So you're right to use the word balance. This is what we're striving for, a balance between the risk of COVID transmission and all the other impacts of this pandemic on the health of the population and children. So The concern is that children are not doing well on other dimensions like their mental health, their families, their parents are reporting much higher levels of stress and distress. And so the idea is when children go to school in the fall, we can establish screening measures. We can make sure there's an education process so children and their families understand how to protect transmission in the schools. I mean, part of that is staying home when you're sick, as usual, but screening, then knowing we would act very quickly as soon as there was a positive case in a child who might have been at school while infectious, being able to keep the cohorts of children together so that we know who to follow up with really quickly and doing that, making sure there's access to testing right away, limiting the transmission. That, it is important. The infection in children tends to be less severe than in older adults. So I think what you're referring to was then how do you protect older adults at the same time? And so it is a matter of trying to limit contact for the rest of us. So if all adults continue with physical distancing, that decreases the risk of transmission further outside of the school population. Each of us still has that important role to play. This is about prioritizing the needs of children and youth and families, who need to work, who need to be able to get back to contributing to the economy, to pay their rent, to pay their mortgage. It all matters for the health of our community. I think we've learned a lot about how to control this infection, and we can apply that. We've also learned from other jurisdictions that there's limited evidence, but where schools have opened in other places, it hasn't been possible to see an impact on the rate of transmission in the community. So this is something we need to keep studying and pay attention to.
Okay, and my follow is you've announced that you're in favor of schools opening full-time 5 days a week up to grade 12. Would you also support that then for university and college students?
Yeah, that's a good question. There's not the same distress being reported in terms of that population, and we saw the highest levels being among parents who are trying to do homeschooling, who are trying to find childcare that doesn't exist or they can't afford. There are a lot of other pressures, whereas university and college students, it's more about them being able to access their education. They have certainly maybe more tools than a young child for learning virtually. So no, I haven't made a recommendation specifically examining that.
Okay, thank you.
Thank you very much. We do have a follow-up from Deborah at 1310 News. Her question is, 30 paramedics were pulled off the job due to mask shortage. What does the city plan to do about it?
So I think there's a bit of context that needs to be put in this thing. So all medical professionals have to use what's called an N95. It's a type of respiratory protection when we do certain medical acts that can aerosolize and put them at risk. So the vast majority, and you have to be fit tested, so it has to fit your particular face and seal appropriately. The vast majority use what we commonly use, a 3M 1805 model, and that's most of our 700 paramedics use that model. We always have, because the physiology of all of us is different, a certain number of people that can't get a complete fit, and there's approximately 30 of those 700 that have to use a different one, which is the 3M 1870 plus. It's not because of COVID that this is something different. That's always existed, and we've always had that extra type of mask, or that different model mask for those who require it. What's happened with COVID is that those masks worldwide, and Dr. Etches in one of her earlier responses talked about our colleagues in the United States, have really locked down the market, and those ones that are often in less supply. And I heard a physician give an example this morning, which is a good one. It's like, if you have size 14 feet, they're difficult to find those types of shoes. The same thing for these masks. They're normally produced limited amounts. And so that's what's happening right now. We don't have them. So the first reaction was, as soon as we ran out for those individuals, or we knew we were running out, we were looking at other options, and we're continuing to do that. There are other options, but they're completely indifferent. They're not 3M masks, so that we go into encapsulated respirators. We've received some. We're going to continue to receive others. That requires then training, etc. In the interim, those 30 paramedics are assigned to other functions because they can't do patient care functions, or we'd be putting them at risk. So we're continuing to work to try to get the ones that they would require, but we're not waiting for that to happen in the market. We're going to use another tool for them, and we hope that eminently the training will receive them all. They'll get training for full face respirators. They're called PAPRs, with a battery pack and a ventilator, and then they'll be able to return to patient care activities.
Thank you very much for this, Mr. Di Monte. We will now be going to Christina Spencer at Ottawa Sun. Christina, are you there? I'm not sure if I can hear you. Can others hear Christina? No? Okay. So we will now be going to Radio-Canada. Mama Afou, vous pouvez y aller. Christina, similarly to Deborah, if you can send the questions via writing, either by email or in this group chat, I can relay your questions.
Oui, bonjour. Est-ce que vous m'entendez?
Oui, vas-y.
Oui, ma question serait pour Madame Dr. H. En fait, j'aimerais savoir quel type de collaboration existe entre la santé publique d'Ottawa et et la santé publique de l'autre côté de la rivière, donc le CIS de l'Outaouais, concernant les mesures, étant donné qu'on est dans une réalité un petit peu différente ici dans la région avec cette réalité entre Ottawa et Gatineau. Donc, j'aimerais savoir, est-ce qu'il y a une collaboration entre les deux autorités de santé? Et si oui, quel type de collaboration?
Oui, on collabore avec notre voisin à l'autre côté de la rivière. C'est chaque semaine que j'ai une réunion avec le médecin-chef en santé publique à Outaouais. Et c'est vraiment utile parce qu'avec les différentes approches de COVID-19, on peut apprendre des choses. Par exemple, avec le début de l'école, c'était clair à Québec que c'était possible d'avoir l'option d'école 5 jours par semaine. Et il y a des processus pour la protection des enfants et des employés où on peut apprendre et utiliser certaines approches le même type. Alors, ça, on partage l'information sur la situation actuelle, les chiffres, les choses comme ça. Aussi, on discute s'il y a différentes politiques pour la protection de la population qu'on a besoin de mise en place. S'il y a nouvelle communication pour le public, c'est important de travailler ensemble si c'est le même message ou d'éviter les conflits. Alors, c'est quelque chose, on va continuer.
Ma deuxième question, elle est encore pour vous, Madame H. Ce serait ce matin, vous savez, le docteur Arruda, le médecin, on va dire le sous-ministre de la Santé du Québec, est de passage en Outaouais. Il a déclaré qu'il donnait l'autorité aux différents CIS du Québec, notamment aux CIS de l'Outaouais, d'imposer le masque s'ils voulaient à leur population. Donc, est-ce que vous, étant donné que nous, qu'à Ottawa, on l'a déjà imposé, est-ce que vous souhaiteriez, étant donné la proximité avec Gatineau, que le CIS de l'Outaouais puisse obliger, elle aussi, les gens à porter un masque dans les endroits publics intérieurs pour qu'il y ait une certaine harmonie entre les deux rives? Est-ce que c'est quelque chose que vous voulez encourager? Surtout, on veut éviter cette deuxième vague que tout le monde craint.
Oui, c'est toujours mon recommandation pour toutes les populations où il y a un risque de COVID, c'est ici et c'est là à Outaouais, de porter un masque à l'intérieur quand c'est trop difficile de garder une distance de 2 mètres. Et c'est le même avis que ma collègue juste là. On va discuter les options que le médecin indique. C'est peut-être possible aussi de faire avoir une directive ou quelque chose de plus obligatoire. On va voir la perspective de notre voisin. Notre expérience ici, c'est que la majorité de la population a l'intention de faire de bonnes actions, de protéger les autres. Mais avec cette prochaine étape d'avoir une obligation, c'est comme ça aide de ne pas oublier le masque quand on sort. C'est un autre outil et on va partager notre expérience et discuter collaboration.
Parfait, merci beaucoup.
Merci beaucoup. We will now be going to questions from Christina Spencer. I will be relaying the questions on her behalf. Unless you want to do one last final audio check, Christina. Okay, so Christina's question is, a month or two ago, the health system's main focus was on protecting the frail, elderly, and immune compromised. This week, the recommendation from public health is that for the well-being of youngsters and students, they should go back to school full-time. After this, I imagine you'll be asked about why college and university students can't be back in classrooms and lecture halls and not just having to do their semesters virtually. It feels a bit like the health advice is piecemeal or siloed, to use that expression, shifting from one group to another, but not really explaining to us how the advice to one group impacts or integrates with the advice of another. Her question is, how are you trying to balance the needs of one group with another? How are you holistically approaching the needs of everyone?
Thank you for that feedback. We continue to learn as we go through the pandemic, and we have different safety measures in place now. So we see the older adults where there was a horrible situation in long-term care and too many people dying, that's been brought under control. And so that's positive. We need to maintain, the attention on older adults and protecting them. I continue to work with the healthcare system to make sure that we have a plan to continue to protect residents in long-term care. So we haven't let up on paying attention there. But what's become clearer is all along we've been trying to assess the health of our population in different ways. We assess the level of infection and where are the outbreaks and where's the risk to the population. And sometimes that's going to direct us to take different measures. For example, we're also, we're more clear that there are certain racialized communities that have a greater risk. And so that shifts where we focus when we're monitoring COVID-19. But we're monitoring more than that. We're looking at the health of the population from a mental health point of view. And that is why, again, it's driven by the data, we're seeing it's parents and young children and youth, not as much the college age, that are reporting the highest levels of distress. And so we're looking then as we move along, what's the balance to make sure we're looking at health holistically, and given the different risk of severe infection in that younger age group. The risk of severe infection grows with each age group as you get older, and so this is the priority for the fall. We know, we have to continue to be flexible and continue to learn as we go along. But they are very connected. We're not different populations. If adults don't do their part to physically distance, we won't be able to open schools very safely. It just means the infection will go into schools. If we open schools with care and screening and methods to reduce transmission, then that protects the rest of the population as well.
Thank you very much, Dr. Etches. Christina's follow-up is also for Dr. Etches. Follow-up back to the college and university students. Could you make a recommendation on being in the classroom for them? They or their parents have paid extra for this education via tuition, etc., and they are also young adults capable of practicing physical distancing. Why not allow them back into physical classrooms?
Again, I don't have a health measures or information that is indicated health reason. So then it's about the educational decisions, and that's not my area of expertise. So I'm sorry, I really can't comment on the approach of that ministry, the universities or colleges.
Thank you very much, Dr. Etches. Thank you everyone for attending today. This is all the time that we have. C'est tout le temps que nous disposons. Wishing everyone a lovely weekend. Bonne fin de semaine à tout le monde.